I'm your host, Ariel Natelick, here on the Berryman News Network, where we aim to bring you fast and informative stories with real-life anecdotes. Today, we are talking about insulin-dependent diabetes, or type 1 diabetes. Our special guest today is Abigail Wegner. Say hi to everyone, Abby.
Hi, Ariel. Thanks so much for having me today.
Thank you for joining us, Abby. Before we jump into our questions, I'd like to first cover what insulin-dependent diabetes is. As you may know, it is a chronic condition that results from the body not producing enough or any insulin. Insulin is an important hormone produced in the pancreas that allows the body to increase glucose uptake and energy production in the muscles and limit gluconeogenesis in the liver. It is also called juvenile diabetes because it is typically a genetic disease that appears in early childhood, but it can develop later as a result of some viruses. While it is mostly believed that people with type 1 are abnormal or underweight, like some actresses like Halle Berry, this is no longer the case. Current numbers indicate that 2 in 3 individuals are actually overweight or obese, which may be the result of societal diet changes. On that note, Abby, at what age did your brother get diagnosed with type 1 diabetes?
We found out that my brother had type 1 diabetes when he was 8 years old. For about 2 weeks before diagnosis, he had been very lethargic and tired, which is very unnatural behavior for an 8-year-old boy. He had been eating just about everything in sight, having probably close to 6 meals a day, doubling his normal amount of food consumption. He was drinking a lot of water all day long, as well as orange juice, Gatorade, really whatever liquids he could get his hands on to combat dehydration. And as a result, was frequently running to and from the bathroom, probably once every hour at minimum, maybe 3 times an hour. We took him to a few doctors to see what was going on because this behavior was very uncharacteristic of a normal 8-year-old boy, let alone my little brother. And they referred us on to more doctors who then told us maybe we should go to the ER. He's exhibiting some strange behavior and some strange symptoms. When we went to the ER, the doctors tested his blood glucose levels and found that they had skyrocketed. A normal blood glucose range for the average adult is in between 80 and 120. For the average 8-year-old is between 60 and 100. His blood glucose levels were above 500, which is the maximum count that a normal blood glucose meter goes to. And as a result, the doctors had to keep him for a few hours to lower his blood glucose levels and inject him with insulin right away. They diagnosed him with type 1 diabetes, ruled out any other potential diagnoses, and told us what we would have to do as a family thereon. We picked up insulin, test kits, blood meters, everything we could think of, and started a new life with someone with type 1 diabetes.
Thank you for that, Abby. As she mentioned, some of the symptoms of type 1 diabetes include increased thirst, frequent urination, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, and blurred vision. And for some young children, wetting the bed when they had not previously done so. On that note, I'd like to ask you, Abby, about the outlook and familial support systems. Tell me, how has this impacted his life and the lives of your family? And has your whole family had to change their diet and lifestyle as a result of this?
Yes, of course, Ariel. Thank you so much. It has definitely impacted our lifestyle as a family. From the minute we had to start, we began counting carbs on every food product in the house. Counting carbs is very important because the amount of carbs that each food item consumed has needs to be measured out in a similar level of insulin to be taken. Diabetics can't just eat whatever they want and really have to watch their carb intake because this is the amount of insulin that is required to combat it once it enters the system and turns into blood glucose. Our family has become extremely aware of which carbs are necessary for intake and which carbs can be sacrificed in daily consumption. For instance, pastas have a lot of carbs in them, usually 45 to 55 grams of carbs per serving. Now, for a growing boy, he's probably going to eat double the serving anyways, but he cannot be intaking all of those carbs regularly. There's a special brand of pasta found at most stores that actually has a lower amount of carbs in it, is made with different ingredients, tastes exactly the same, and is something we quickly substituted to. We ended up becoming great friends with a lot of people around our area, also in the diabetic community, also with sons or daughters who had type 1 diabetes, and we learned a lot from them. We learned how to best manage blood glucose levels, which kind of foods were best to eat over other foods which are not so great to eat, which foods have almost no carbs, so do not need to have insulin also taken for them, such as deli meats and cheeses, as well as carrots and celery. And we really formed a huge sense of community with people we would have never met in our everyday neighborhood. We also, as a family, have always led a very active lifestyle, but this is something we definitely began to focus on more as we learned that this is something my brother would need to uphold as a person with type 1 diabetes. People with type 1 diabetes can easily have other onset health conditions that occur alongside the lack of insulin being made in their bodies. They can have chronic nerve damage, as well as damage to the feet and hands, being extremities, and can just have many different problems that occur throughout the body. To avoid these, it's best to stay athletic and active and lead a very healthy lifestyle. So our diet became very, very healthy very fast. No simple sugars, nothing out of the ordinary of a regular diet, includes all food groups, and we quickly became very active. My brother played all sports growing up, as did I, and my parents would regularly make sure that we got outside and got some exercise in.
And has this impacted your career choices at all?
Yes, Ariel, I would definitely say that this impact on my family has absolutely influenced my career choice. Once my brother was diagnosed, he was sent to many different specialists who work with many different areas of the bodies, from endocrinologists to gastroenterologists to even ophthalmologists. He was tested for every possible side effect of having type 1 diabetes and thankfully came clear of all. However, these are all conditions that could worsen with time, including, as I previously mentioned, nerve damage, damage to extremities, ocular damage, general fatigue, and other symptoms. I was not always present for all of these doctor's appointments, but I would always hear my parents talk about it once they came home, and we would always receive lab reports back in the mail. Seeing everything that my brother had to go through, seeing so many specialists, learning so much about how his body worked with this disease was really inspiring for me. And neither one of my parents are physicians nor in the clinical field, but I decided that going into the clinical field was definitely a career path I would like to pursue. I definitely think that if my brother had not been diagnosed with a chronic illness such as diabetes type 1, that I may not have chosen to go into a clinical career. Neither one of my parents are physicians, as I mentioned, and no one in our family is closely tied to the clinical aspect of careers or business or general life. So this was a huge change for my family, and we had to make a lot of adaptations. Seeing how all of these specialists communicated with my brother about his conditions and the likelihood of developing more conditions was definitely a huge change for me, and something that I thought was actually an interesting side of diabetes, something that maybe wasn't so bad in such a looming condition.
Thank you for that. Okay, now I would like to talk about outlook and long-term complications with patients. Some of the long-term issues that you may have in older age are heart and blood vessel disease, particularly with overweight individuals, nerve damage, kidney damage, eye and foot, skin and mouth conditions, and pregnancy complications for women. That being said, many of these don't occur until later life. Let's talk a bit about some of the treatments for type 1 diabetes. Abby, can you tell me, how does your brother handle this? What is his treatment?
Right, so for treatment, we went ahead and decided to use the very common method of giving insulin shots. Now, for an 8-year-old boy, it's a little bit hard to begin receiving shots every time you eat a meal. So we tried to create a schedule where he would only have to receive the shots morning and night, and the amount of insulin taken would cover what he ate for the day. This meant planning out all meals, which was very difficult for someone who's impulsive and, of course, wants candy and snacks like all other 8-year-old boys do. As he's aged, we have switched to the pump system. The pump is something that attaches to a belt loop or pants, and a needle inserts with a cord into an area of the stomach or back region, wherever there's most body fat. The pump monitors regular blood glucose numbers throughout the day, so the element of pricking a finger to draw blood and then testing that blood sugar level on a regular blood glucose meter is taken. So it's a lot more convenient for day-to-day, second-to-second, minute-to-minute use. If the pump detects that blood sugar has risen too high, it can deliver as much insulin as programmed for set numbers within the machine, and has a certain amount of insulin present within it at all times. This insulin does need to be refilled once it is used, which is often throughout the day for someone who eats often. However, because my brother became so active, he started trying many different sports, including competitive diving off of regular diving boards into a pool of water. My brother became very, very good at the sport and still does it today at 17 years old, but having a pump was not necessarily conducive to the sport. The pump, again, injects by inserting a needle into the body that is covered by a patch. The patch has a cord strung along it that attaches to the pump, and this is how blood glucose levels are monitored, as well as how insulin is given into the recipient. When my brother would dive into the water, especially from greater heights like 5, 7, and 10 meter platforms, the patch would easily become removed from the body. The patches are meant to stay in the body for 2 to 3 days on end in general use, so having the patches removed every so often would pull the needle out, not be a fun experience for anyone, and really make the pump an unreliable tool. When my brother was about 12 years old, we switched back to using needles regularly, and that's what he does now. He takes a needle full of insulin and injects the medicine every time he is prepared to eat something or directly after he eats, and has to total up the number of carbs in his head or on a sheet of paper and then convert it to the amount of insulin needed to be taken. He does this at every meal. He does it at every restaurant. He even does it at school lunch. And this is something his peers have had to become used to, and something he's had to become used to, as something that generally causes a shift in attention towards him.
Thank you for that, Abby. As she said, usually insulin injections are used for people with type 1 diabetes. This is because a true type 1 diabetic produces almost no insulin. In this case, it's necessary to have insulin injections to control blood glucose levels. However, some other therapies that are used are careful monitoring of diet and exercise, weight management. This one's really important for modern times because, as I said earlier, one of the things that we're noticing about today's type 1 diabetics is that they're struggling with weight, when previously it was thought that most of them were underweight. Another thing that happens with treatment of type 1 diabetics is that there are some drugs that can be used in conjunction with insulin injections. One such drug is pramlintide.
He also takes the Lantus medication at morning and night. He takes a set dosage every single day, and on days when he has extra food or needs to carb for extra materials, he takes a bolus shot. Lantus and bolus are simply different brand names of other brands of insulin, but they are meant to cover overnight activity during sleep when the body's not active and nothing is actively being consumed. This helps regulate blood sugar levels. These shots are very helpful because if my brother maybe makes a mistake in his math throughout the day and takes too much insulin or not enough, these shots kind of help him correct the amount of insulin needed in his body to monitor these blood glucose levels so that they stay at a good range in between 80 and 120 for him.
That's all for us today. Tune in next time to hear about another health condition where we aim to bring you the most quick and informative stories about medical conditions of our world. Perhaps next time you'll hear about type 2 diabetes. See you next time.